Welcome to DDN, Desi Dunia Network. In today's regular segment of our medical information, we are bringing you a discussion on common condition heart failure. With us today, we have Dr. Nandan Anavekar, who is a cardiologist and a cardiac radiologist in Mayo Clinic, United States of America. Dr. Anavekar, are you in any way related to our Dr. Sadanand Anavekar in Melbourne, who is a leading cardiologist?
Yes, I am actually. I'm his second son.
Wow.
But I left the nest and went to the US to pursue cardiology.
Oh, that's very interesting.
Yes.
Wow, that's good.
Great.
Small world.
It is.
Welcome to our program, Doctor.
Thank you so much for having me. It's a great pleasure.
Right. We have very common condition of a heart failure in our community, and we have very little knowledge about heart failure and all this. So we are going to find out more about this one from our doctor. Doctor,
Yes.
what is the heart failure?
Sure. That's a great question. So first, we've got to define, what does the heart do? The heart is, very simply put, is a pump, okay? And its only job is to pump blood throughout the body, okay? And it has two sides to it. There's a right side, which pumps blood to the lungs. And in the lungs, the blood gets its nutrients. It gets oxygenated. And then that blood comes back to the left side of the heart, the left pump. And then that pump takes all that blood or pumps it all over to the body and gives the nutrients to the body. What heart failure is a condition when the heart is unable to pump the blood at a rate that meets the body's requirements. Okay?
Right.
So that's really heart failure, and that's under a big umbrella
Yeah.
of several different causes of that heart failure.
Right. Then is it common condition among everyone compared to Indian?
Yeah, that's a really good question. With heart failure, I think that what we need to do is take a step backwards
Yeah.
and ask ourselves, what are the causes of heart failure? Okay, and under the causes of heart failure, it's good to look at two major distinctions. One is that heart failure that's caused by coronary artery disease. So I think it's very common for us to understand about that individual who's had a heart attack because of a blockage of a heart artery, and that's coronary artery disease, and in the professional terms it's called ischemic heart disease. The other major group of heart failure is what we call as the non-ischemic or the non-coronary artery disease associated heart failure. And under that sort of umbrella of disorders, there's a large number of specific illnesses that cause heart failure. Unfortunately,
Yeah.
most of those are still unknown, or they're called idiopathic.
Idiopathic.
Okay, but thankfully, the treatment for heart failure, whether it's because of coronary artery disease or other, is essentially very much similar, and it's really based on medicines which have shown over the test of time to be very efficacious and very helpful, and therefore allows patients to continue to do the activities that they're used to doing.
So you described what is heart failure and what causes heart failure.
Right.
Please.
Right. So as I said, the biggest risk factors for heart disease are the same risk factors that can cause heart failure. Okay.
Right.
So those risk factors include having high blood pressure or hypertension, the presence of diabetes mellitus, the risk factors for causing coronary artery disease, for example, smoking, some non-modifiable risk factors being, for example, a male gender. So all of these risk factors, and especially family history of heart disease, can predispose an individual to develop heart failure down the line. Now, under that umbrella definition of coronary artery disease, what typically happens is an index event or a heart attack. Typically that patient has been doing well, unfortunately has a sudden onset of chest pain, and that's the index event or the index heart attack. If one is lucky, the heart attack is treated immediately and the heart damage is very much limited. Unfortunately, it has been and it remains so that people wait too long to get attention for their heart attack. And therefore the damage to the heart muscle, unfortunately, remains a big factor even in today's contemporary practice where we have so much technology at our fingertips. Because of that, the heart muscle is damaged. The more the heart muscle is damaged, remember the pump function of the heart is compromised. And because of that compromise in that pump function, the patient can then develop the symptoms and the signs of heart failure. And that's what we begin the treatment in the hospital, and then it gets transitioned to the outpatient. Now that's the very typical cause of heart failure that we are all aware of, the person who has the heart attack.
Yeah, just a chest pain.
Exactly.
Yes.
But there is another group of individuals who can also develop heart failure, and that's not necessarily related to coronary artery disease. And this second group can affect a whole range of individuals from age range of very young, kids, young adults, to much older age group as well. And again, this is called as the non-ischemic, or non-coronary artery disease related heart failure. Now, these individuals come to attention a little bit more insidiously. And it's mainly the symptoms and signs of the heart failure that bring them to attention. And in distinction to the patient who comes with a heart attack, these individuals usually come to the office because of their symptoms. And then they develop, they have that evaluation and then have the diagnosis of heart failure.
Right. That's interesting to know. Then when patient comes to you,
Right.
how do you evaluate it and what treatment do you conduct?
Right. So the evaluation of heart failure begins first in the office, in that interaction with the physician. And first and foremost, it begins with a detailed history and physical exam. A history is basically like what you're conducting here as an interview. It's an interview between myself and the patient. And I'll be asking the patient about what sort of symptoms they're having. Now remember I talked to you about the heart being a pump.
Yes.
If that pump is pumping normally, the blood flow circulates through the body's tissues at a normal rate. But if the pump is dysfunctional, it means that not all of the blood is going where it needs to go. And the most important symptom of heart failure is one of congestion. If the congestion occurs in the lungs, the patient will present with shortness of breath. If the congestion occurs in the other parts of the body, it can present with edema or a puffiness, for example, leg swelling. Or increasing in the abdominal girth. That's where the fluid backs up. Another important symptom that we need to be aware of is fatigue. Now remember, the heart pump isn't working so well now, right? So all of that energy is being expended and the body is unable to keep up. So the patient has fatigue. Sometimes, because if the heart pump is not working well at all that congestion that backs up in the lungs occurs at nighttime when they're lying down flat. And the individual might complain, hey doc, I've been waking up in the middle of the night really short of breath. So these are the symptoms that I'll be trying to elicit when I talk to the patient. Then I have to examine the patient. And when I examine the patient, I'm looking for those signs on the body that corroborate with the symptoms that they've told me about. So for example, I'll be listening to their lungs, and on the lungs I'll be listening for any abnormal breath sounds that may indicate fluid in the lungs. I'll be feeling their chest to see how big the heart is. Usually in heart failure, the heart pump or the heart enlarges. So we look for the signs of that on the physical exam.
Oh, okay.
With the stethoscope, I'll be listening to the heart, the heart sounds.
Yeah.
Typically, it's just a lub-dub, two heart sounds.
Yeah.
But individuals with heart failure may have added sounds, or they may have murmurs.
Right.
Okay.
That's interesting.
I'll also be examining their tummy to look for signs of fluid, and also their legs, again, to see for excess fluid. Once I've done the history and the physical examination, then we have to do adjunctive tests, because if you came to me and complained of shortness of breath, and I examined you and I heard some abnormal breath sounds, that could be heart failure, that could be asthma, that could be anemia. So the purpose of the next step is to really cut down onto the exact diagnosis.
Right.
And that's what we would do with the next set of tests. And that would include, for example, blood tests. And in the blood tests, we look at the minerals in the blood. Okay, we look at the kidney function. We would look at the thyroid function, because sometimes the abnormal thyroid function can lead to heart problems. And then it would lead to imaging tests. And the imaging tests have a spectrum, from very simple tests like a chest x-ray, where we would look at the size of the heart, we would look at the lung fields to see if there's any extra fluid there, to more sophisticated tests like an echocardiogram, which is an ultrasound of the heart and looks at the heart size, shape, and function. One of the cornerstone testing that we look at is the electrocardiogram as well. The electrocardiogram is very important because it tells us about the rhythm of the heart, and it can give us signs of prior heart attacks.
So that's a ECG.
ECG, exactly.
Right, okay.
Electrocardiogram and
Yeah,
ECG.
ECG. Yes.
So that would be the basic
Right.
beginning evaluation
Right.
of somebody who comes to me
Yeah.
with symptoms that are suggestive of or suspicious for heart failure.
So regular blood check is essential then.
Absolutely. Absolutely.
Right.
Absolutely.
Okay. Then once you made the diagnosis, and how do you treat it?
How do you
please?
treat it? Yeah, absolutely. Over the past several decades, internal medicine and cardiology have really paved the way in terms of the treatment of heart failure. And that's really occurred because of aggressive testing of new drugs in large clinical trials. The focus of treatment in heart failure is to firstly get rid of excess fluids, and that can be done with water tablets or diuretics. And then the second part of that is to use medicines that help the pump function better. Okay?
Right.
That stops the pump from really enlarging and becoming inefficient. These medicines, as I've mentioned to you, have been tested over decades and have shown to be extremely efficacious. Thankfully, although there's a wide spectrum of different diseases that can cause heart failure, the medicines that we use to treat them all are essentially the same.
I see.
Okay?
Right.
So again, the key is that we get rid of the excess fluid first.
Yeah.
That's a group of medicines that the patient will know as water tablets.
Yeah.
They're diuretics.
Yeah.
And then there's a second group of medications, which I won't go into because it's beyond the scope of the discussion. But these second group of medications really help the heart maintain its function and sometimes even improve its function over time.
Oh, I see.
One of the tests that I talked about is the echocardiogram, and something that a lot of people will be aware of is the ejection fraction.
Right.
And that's something that a lot of people cling on to. And it's a good parameter. And a normal ejection fraction is something over 50%. And people with heart failure can have really low ejection fractions. But the use of these medicines can keep the ejection fraction at its level, or can in fact improve it to even normal levels.
Okay.
Yeah.
So this can be done with
medicines. Absolutely.
So this is a non-surgical.
Right.
Okay.
Heart failure is treated primarily with medicines.
Yeah.
But like I also mentioned, which I'll just touch up on, is that medicine has advanced so much technologically that there are now devices that can be used in advanced heart failure.
Right.
Okay, to
Okay.
again help the heart function better.
Mm-hmm.
Then obviously, the very end stage of heart failure, we use really potent medicines to help the pump function better. That's usually given in intravenously.
Intravenous, yeah.
And that's really leading towards the final sort of therapy, which includes heart transplant.
Heart transplant. That's the surgical.
That's the surgical sort of treatment.
Okay.
Yeah.
So, with the people who had a heart failure,
Yeah.
can they lead a normal life,
Right.
doctor?
That's actually a very important question.
Yes, many people ask this question.
And it's very important to answer.
Right.
I think that when the diagnosis of heart failure is made,
Yeah.
there has to be one important step, and that is compliance with the therapy.
Right.
So, to answer your question, can an individual with a heart failure lead a normal life? The simplest answer is yes.
That's good to know.
But
Yeah.
the caveat is yes, but it depends on. And it depends on the individual being able to be committed to major lifestyle changes.
I see.
So, if you have an individual who comes in with a heart attack,
Yeah.
and then is started on the right medicines, and then goes home on those right medicines, but then continues to smoke, and then continues to have, dietary indiscretion,
Yeah.
then without any doubt in my mind, I can tell you that that individual will continue to have symptoms and will be continued to be limited in their lifestyle activities.
I see.
On the other hand, you have the same individual, the exact same individual with the exact same heart attack, but they make major lifestyle changes. They're committed to exercise. They're committed to taking their medicines. They're committed to meeting their doctors regularly.
Yep.
Those individuals should have no problems
I see.
in doing the activities that they've been used to doing and enjoying. But again, it really depends on that therapeutic relationship. With everything, there are always exceptions. Now, there are going to be those individuals who do their very best and they are very compliant, but despite that, the illness progresses. And it's in those individuals, that group of individuals, where thankfully we have these advanced therapies.
I see.
Right.
So the lifestyle change is a major
Absolutely.
thing they should be aware of.
Absolutely. Absolutely.
Doctor, what are the lifestyle changes one can make into their life, please?
Yeah. So, in the setting of heart failure, the biggest lifestyle change that an individual must take seriously is with regard to their diet, okay, and exercise.
What they eat.
Exactly. And specifically for the diet, it's salt and fluid restriction. So if
Yeah.
you remember, we talked about congestion being a major problem. Our body is designed to save itself, right? So in the good old days when we used to run away from the saber-toothed tiger, we had to figure a way of conserving our blood volume. And our body did this with salt. So if we take extra salt, our body is tricked into thinking that we don't have enough water around us, okay? And in doing so, it holds on to more water, and it can make the congestion worse in the setting of heart failure. So the biggest point in lifestyle changes for an individual with heart failure is to limit the salt intake and to limit the fluid intake.
Right.
And that goes hand in hand with the medicines that we give to treat the heart failure.
But they say you should have enough fluids, that is the 2 liters of water in a day or something.
Right, you're right.
Yes.
But again, that's for the individual who has a normal circulation.
Oh, I see.
In the individual who doesn't have a normal circulation, their body tends to hang on to the water.
Oh, I see.
Because of the physiologic response to the reduced pump function.
Right.
And what we need to do after understanding that is to regain that equilibrium. And the best way to do that, and what all the medicines try to do, is to reduce the excess fluid by restricting the fluid intake and by restricting the salt. They're very challenging things to do. It's not easy. It's easy to say.
Easy to
It's
say.
very difficult to do
In
because we add
food,
salt.
of course, in every
absolutely.
food, chips and everything, there is added salt
Absolutely.
everywhere. So,
And even in things we don't consider.
Yeah.
So the soups.
Oh,
People
yeah,
who drink
soups.
soup, they say, Doc, I've been very healthy doing my part. I just have the canned soup that has a lot of salt in it.
Yes.
And that
Yeah.
people just need to be aware of that.
aware of. Basically, awareness is important.
Absolutely.
That was a very good informative insight into this heart failure, doctor.
Thank you.
And to our viewers, what's the take-home message?
Right. I would
Please.
say the take-home message for heart failure is one.
Yeah.
Heart failure is a clinical diagnosis. We make it after interviewing our patients and examining them. The symptoms are usually one of congestion, can be including shortness of breath if there's lung congestion, increasing abdominal girth and swelling in the legs, as well as symptoms of fatigue.
I see.
There are tests that we use that range from very simple to more sophisticated that can help us with the exact diagnosis of the heart failure. And there is treatment, and thankfully the treatment for heart failure is pretty robust and can be used for the different etiologies of the heart failure. Individuals with heart failure can live normal lives as long as they are committed to the lifestyle changes as well as the medical therapies that are implemented. And as long as they keep up with their follow-up appointments and keep in touch with their doctors,
Yeah.
there should be no problems.
That's a very good information, doctor.
Thank you so much. It's really been a pleasure.
We are very glad to have you with us today, and we look forward to have more of these sessions in future.